The COVID-19 pandemic has brought some division among Canadians with differing opinions on how to handle things and growing frustration and impatience with the lockdowns. Today's guest is a political scientist and a senior fellow at the Frontier Center for Public Policy. He joins us from Calgary via Skype. Dr. Marco Navarro-Genie is the co-author of COVID-19, The Politics of a Pandemic Moral Panic. It's available on Amazon. Dr. Navarro-Genie, thank you so much for joining me today.
It's a pleasure to be here. Thank you for having me.
Now, that's an interesting title for a book. Most people call this a medical pandemic, but you're calling it a pandemic of moral panic. Can you please shed some light on this?
Um, yes, the title has something to do essentially with what the book is about. In the book, we examine the reaction or the reactions to the COVID-19 crisis using the lens of this idea of moral panic. The idea of moral panic was published in a book in the 1970s, and it was an examination of people's reactions to drastic events. In the book is about riots. So moral panic occurs when a person, a group, or an event arises that poses a certain threat to society, to the existence of society, real or perceived, and to the values of that society. So, to my co-author and I, this is what seems to be going on here. That there is an enormous amount of panic, and we document and track the development of the arrival of the virus and how it has, for example, excuse me, first fueled, the panic is first fueled by the statisticians' models. We seem to have gone to statisticians to look at what could this virus do. And we seem to have honed in on the worst case scenarios in these models. There were many different models, but we chose the worst case scenarios. And then the medical bureaucrats chose to use these alarmist models to inform the decision makers and the policymakers, which is what has resulted in these lockdowns. So, and the worst part of it, of course, is that we chose the worst models, and we chose the models made by a guy who had absolutely terrible reputation, who had made many models for very many different things, and never had anything right. And that frames the problem in many respects.
So, who is this person that framed this model then?
His name is Neil Ferguson. And Ferguson had a terrible reputation in the scientific community because in many of his earlier models, he was off by orders of magnitude, and they were always extremely alarmist. He eventually got booted out of the council that advised the British Prime Minister for sexual transgressions, but not because his science was terrible.
Interesting. Okay, so you say the spread of viruses like COVID-19 is actually not a new thing either. But what is new is our current way of responding to it. So, what's the underlying cause of our different response this time? And is it possibly that model that you were talking about just now, or is it something else?
Yes, that is a component of it. Look, since the so-called Spanish flu at the beginning of the 20th century, this is the fifth world pandemic. Right? And in all the other pandemics, some of them have been really bad. Of course, the Spanish flu was absolutely terrible. We have never, ever resorted to locking down entire populations. This is a total experiment. In the past, and going hundreds of years before, when there were pandemics, we had the tendency to isolate people who were sick. And here, we think, or we argue, that induced by this moral panic, that the models were telling us that there were going to be tens of millions of people dead, that we decided to go and hide, as if one could hide from viruses. I mean, clearly we have demonstrated that it is nearly impossible to hide from a virus. And so What is different here is A, the panic that we have induced ourselves into, and B, the power that technocrats and bureaucrats have amassed for themselves and have been able to essentially push a single idea or a single panicky model in direct contrast and competition to all the other models and all the other information that we had that was way less alarmist.
So, do you think politicians and media organizations tend to are they using fear and panic as a way of wielding more control over the public? Like, is it intentional, or do they genuinely believe that there's a massive health risk to the public and that they're doing the right thing?
The author of the book, Moral Panic, the original Moral Panic book, Stanley Cohen, um, dealt with this issue. And he found that just because a lot of people are making similar decisions doesn't really mean that there is a conspiracy. And we've had to deal with this in many ways. We think that there is an aspect of human nature here that pushes people to a certain kind of decision when they have induced themselves into a certain kind of fear and panic. And we see it, for example, in relation to some of the decisions that have been made by the medical officials. Um, it's not that they have been uh, conspiring against the public. It's just that they have been flip-flopping on decisions left, right, and center, precisely because, well, they haven't been able to figure it out that there is a way of doing things. And so, in addition to that, of course, they have overstepped their boundaries in ways that no one could have imagined. And so, there is a tendency among these people, to be bedazzled to some extent by all the attention, but they're real people, and real people always want to take advantage of situations to amass more power, to advance their careers, to move forward, if you will. And so that's what we see, that these medical professionals and medical bureaucrats have essentially seized opportunities to continue to advance their own causes, and in some respects become hyper conservative in some of their decisions because they are seized by fear.
And then there is something else that's concerning to many as well, and it's how some social media giants are censoring free speech. So, if any medical experts voice a dissenting opinion from the current politically correct narrative, they're shut down because they're considered to be spreading misinformation. So, why is this happening? Why are we letting this happen?
There is a real paradox here. Um, Media are amplifiers of the moral entrepreneurial message. These people who have seized the opportunities to essentially send us into a panic, and so the media has taken that and amplified it. But again, uh, there is a kind of division in a culture, and the media is a reflection of that. At the same time that we have, for example, media suppressing information because they don't want the public to panic, uh, we are making people panic because they're suppressing information. We no longer live in a world where information can be totally controlled. And so the social media channels, for example, um, are home to many people who have different areas of expertise, who can put things to a lie very quickly, even when the public officials come with opinions that are, well, plainly wrong in many respects. And so there are attempts at trying to, and this is part of our culture, the culture of canceling, the culture of only having one opinion prevail, is what is driving these social media giants to try to be, in a sense, politically correct. In a sense, perhaps they do think that they're doing a service to the public by only moving official opinions. But we know that the official opinions have been just as wrong in many respects, if not worse than any others. Of course, then we always get into the other aspect. We talked about bureaucrats seizing opportunity to seize power and become more powerful. We have seen, for example, a prime minister in Ottawa who has taken almost every opportunity uh, uh, to to circumvent responsibility, to try to push Parliament aside to make decisions. We haven't had a budget in over a year, supposedly because there is a pandemic, and yet there are countries that are larger with greater economies that are moving on and have budgets presented. So it's that kind of dynamic in which the social media channels are trying to only move official opinions, but the official opinions are either wrong or sometimes semi-tyrannical.
Now, you write about the approach that the nation of Sweden has taken, if we're comparing Canada to maybe other nations. So you write about Sweden, where they haven't locked down the economy, and many have been critical of that approach. But how do you see it?
We use the Swedes in the book as a kind of counter example, because the Swedes are one of the countries, and certainly the only country among social democracies in Western countries, that refused to enter into a complete lockdown. There are many social reasons in Sweden as to why this was done, but in a nutshell, the Swedes had been preparing for an emergency plan for 5 or 6 years leading into this. So when this virus hits, they have a fresh plan, is fresh in their memory, and they just simply went to execute it without panicking. One of the fundamental differences is that the Swedes understood that public health is not or should not only be dictated by one disease, which is, say, in this case, COVID-19, that they understood that there are implications for all other aspects of moral life, economic life, family life. They understood that there are, and there are, this was not news to them, that there are such psychological effects, that crime is affected, that human beings, families, violence against women, violence against children, are all affected by locking people down. And so the Swedes opted for a more measured plan, which was to isolate and try to protect the people who were most at risk and let the rest of the population move about more or less without any interferences. They closed down universities, they closed down high schools, but the elementary schools continued to run. They did not close restaurants, they did not close businesses, but there were some restrictions of social distancing and whatnot. So it's not that they did nothing, but they chose a more open way to deal with the problem without sending themselves into a panic.
And what were the effects of what Sweden has done? How have they been doing in terms of?
Sweden has been vilified for it because in some respects they have had a higher death toll than some of their next door neighbors, but they have done much better than places like France, Spain, Belgium, and other European countries. So really, they lie at the average. But because Sweden's policies put all the other policies of lockdown on the microscope, essentially, people have been attacking the Swedes almost gratuitously. What the Swedish case really shows is that we didn't have to lock down, that lockdown was a choice, and it was a choice that our politicians made, and therefore they need to be accountable and they need to be responsible for these choices, for all the businesses that have been ruined, for all the extra death that have been caused. That's what they're trying to avoid by attacking Sweden almost relentlessly.
Right. Any thoughts on where this is ultimately headed for Canada, for the world?
One of the interesting things that comes out of looking at Sweden is that the Swedes had taken the time to think this through pretty much all the way to the end. And one of the things that they understood from the beginning is that it is impossible to contain a virus. Viruses have been around for tens of thousands of years, and they're job, so it's nearly impossible. It is impossible to stop them. And so the Swedes understood that if you lock down, you're going to cause an enormous amount of harm, you're going to open up, and then the virus will then again flourish, and then you're going to have to lock down again, and then lock down again. And they saw that this could lead to an effect of essentially an endless, potentially, numbers of lockdowns, which would cause even more harm to businesses, to individuals, and all those cycles of consequences that we talked about. So um, we should, by the way, be consciously aware that the vaccine is not a magic wand. The people who are sick are already sick, it's not a cure. And since we are not going to vaccinate the entire population all at once, the virus will continue to move. People have understood that the virus is not as lethal as they had painted it out to be, which has been a disservice made by the politicians as well, because people are not afraid anymore. Um, you don't see the fear in people's eyes that you used to see back in March. People are trying to follow the rules, but are less fearful. They're moving around. You hear on social media, people are going to go and visit their relatives during the holidays. People are fed up with this. And so the propagation isn't going to end. My guess is that this 4 weeks that we're supposed to be re-locking down in Alberta are not significantly going to reduce the number of cases, and that once the vaccines arrive, it will take some time before this whole thing levels off.
Dr. Marco Navarro-Genie, thank you so much for your thoughts. Very interesting insight there. Thanks for your time today.
Thank you for having me. It's been a pleasure.